it's a practical exam kind of a thing. And the second one is a main hurdle, right? So majority people clear the part one, but the part two becomes a little tough for them. Now let's look at it, why it is tough, right? So first of all, everything in life is not going to come easy to us, right? There are going to be certain things that we have to work a little extra hard. And we've already done that. We've prepared a lot. We've gotten our specialty of choice. And part two is something the same way. It's a challenge, right? So it is not something that you have to be scared of. You have to take it up as a challenge and you have to keep on working hard towards it. So in part two, they mainly test our basic understanding of the subject per se. So in part one, they just skim through over like the pharmacology, physiology, the anatomy. But part two is the major chunk. What is that? That is what we do in our clinical practice. It is basic obstetrics and gynecology to its core. Okay. And some other subjects like there's statistics, there's clinical governance, there's teaching, auditing, all of that. So let's talk a little bit more. We at Med Instutors are going to offer you a 5-month study plan, and this is what I'll be talking about. Now, first of all, we at this point of time are really stressed out because we know that the curriculum for part one is very, very small compared to part two. Part two is more, as I said, a bit daunting, and there is a lot of study material, right? Because the modules that we have to cover under it is a lot. There are oncology, there is, subfertility, infertility, maternal medicine like hypertension, diabetes, epilepsy, infections, infections during pregnancy. Then there are all of this can be studied through guidelines in the form of green top guidelines, which are given by the Royal College. Then there are reviews in the journal called the Obstetrician and Gynecologist. There are BASH guidelines, and the FSRH guidelines, which are for infections and contraception. There comes clinical governance, biostatistics, and embraces related to maternal mortality. Now, what do we have to study in all of this? Looking at so much of material, it becomes very confusing what we have to do. Now, first of all, at the outset, I'd like to tell you all of this is available on the internet for free. Okay, maybe only talks is something that you would need a subscription for, but do not worry, we are giving you the talks through the subscriptions that we have, and you can read the whole articles. So, first, let's talk about the Green Top guidelines. If you go to the RCOG website, you will get the Green Top guidelines, right? You will get the Green Top guideline and you will just have to go through it. Now, how to read a Green Top guideline is something I will cover in the subsequent slides. But the first resource that you have is GTGs, and that's free of cost online. The second are NICE guidelines. Now, the major difference when you actually look at a NICE guideline and a GTG is the number of pages, right? So GTG is around, let's say, 20-30 pages, and your NICE guidelines are going to be like 100 pages, 80 pages. And that itself becomes mind-boggling, right? At the outset, you're like, oh my God, I have to read so much. But do not worry. We will guide you as to what is important and what needs to be picked up from the guidelines. Next are scientific impact papers, which are also available on the RCOG website. And then other reviews from the obstetrician and gynecologists. Are we clear so far about all the guidelines? And also, as I said, there are supplementary guidelines from BASH and FSRH that we have to do for infections and contraception. So it is very important to understand for what we have to read from where. Okay. Next, what do we offer? So first of all, we have to understand that completely reading in and soaking everything in is not how you can clear this exam, right? Either you have two candidates, right? One candidate is read the whole Green Top guideline 10 times, right? There's another candidate who has read the same Green Top guideline maybe thrice, but has read it in a smart way and has solved questions accordingly. That is smart studying. And as mentors who will be with you during the program, we will help you to come up with a study plan. We'll tell you what to read and what not to read, right? Like if, for example, you have epilepsy in pregnancy, we will tell you, okay, in the lectures that will be offered to you, there will be important points that this is asked in the exam or this is the question that will be there. And there will be questions which are solved so that you know yourself that what is important in the guideline. Then you have to understand how you have to solve the questions. Because solving multiple choice questions is an art. It is something that is not only developed, but it is also something that has to come to you naturally. And it also helps by practicing MCQs and EMQs. So I will be talking about what type of questions that are there in the exam. But understanding the question is very important. This is not your regular vibe, or this is not your long answer question that you write in your university exams. This is a different form of question. You've already done that in the part one. You've answered single best answers. Yes, there were recalls, but this exam does have recalls, but it also tests your understanding and your concept is clear or not. Okay. Another thing that we offer in the program is regular self assessment. Because as I said, practice, practice, practice is the most important thing. Because you can't just blindly read and solve the exam, right? You have to actively learn. Lectures are didactic, right? You can learn them. You will just, okay, a mentor is telling you this is there in the guideline, this will happen. You will listen to it. But when will you revise it? And when will you actively retain in your conscience? So this is what is the use of regular self-assessment. We have interactive learning sessions, and in our model that we are offering this time, we don't only have the lectures that are available to you, but we have follow-ups live sessions. These follow-up live sessions will be for your doubt clearance, for discussing any difficult part of the module that you have found, and any other topic that you want to be covered, right? There will be group study, obviously, because studying alone becomes scary. When you have people who are working towards the same objective, it becomes more motivating and more helpful. There will be mini schedules. As I said, there are different modules, and each modules we have broken down for your ease to study, so that you all can cover. Let's say if you're reading one guideline on epilepsy and you're reading one talk on the same day on tuberculosis, you can read that together, right? And revise it together. So in one day, you're not studying 100 things. You are doing it day by day. Next is stress management and motivation. Now, this is something that comes hand in hand with our field, right? Stress is ingrained into us, but managing it is what is crucial. And we as a team are here to help you to manage the stress, not only with mentors, but also with your peers. Another thing that was important is resource management. As I said on the earlier slide, that you have myriad resources available on the internet and it's for free. You will have different courses that will offer you, this is your GTG, this is your your talk. But what to read, when to read is also important. Thus, management of these resources is equally important. And as I said, the mini schedules will help you break down the curriculum into small nuggets so it becomes easier to learn and revise. Now, looking at the exam structure, this is a computer-based test like your previous exam. And again, it has two papers, part one and part two. And this is further divided as single best answer and extended matching questions. A single best answers is something that you're already familiar with. But the challenge of this exam, I would say, and I wouldn't say challenge or difficulty, I would say the essence of this exam and the way you can actually have fun solving it are the extended matching questions. So in extended matching questions, you have a number of options that they give you. They give you from A, B, C, D, E, F, G to maybe even Z. These are the number of options that they give you, and they will give you a STEM. Like they'll give you a clinical scenario, okay? And you have to choose the correct option. So, so what happens in such a case? In single best answer, you can take an educated guess. However, in extended matching questions, it is crucial that you know your concept very well so that you can come to a correct answer, because it becomes impossible to eliminate questions. Max to max, you can come up with two questions and two options in from the EMQs, and you have to eliminate out of the two. You cannot use the same tactic that you use for solving single best answers for extended matching questions. We in our program will help you tackle extended matching questions, because as I said, this is something that you have to look at as a challenge and overcome it. And also 60% are extended matching questions. So this exam does have a higher mark given to extended matching questions, right? So paper 1 and paper 2 are both 3 hours, 180 minutes each, 50 SBS, 50 EMQs. They can, vary. You can have first obstetrics, then gynecology, or first gynecology and obstetrics. It keeps on changing. So my exam had first obstetrics with EMQs of gynecology, then SBS of gynecology and EMQs of obstetrics. Okay. A time management suggestion that we give is basically to give 70 minutes for SBAs and 110 minutes for EMQs per session, because EMQs do take longer to read itself and understand what they're asking and to understand the options. Okay, so the next slide is a bit crowded because that is what you have to read. But do not worry, do not get scared by by the number of things that are to be read or to be retained. You have to look at it as something that is challenging. Okay, so first, these are the 18 modules that you have to cover. You have to read them. There are questions asked from each module. Some modules will obviously have more questions, like for example, maternal medicine and natal care will have more questions asked because they're more commonly, they also want what is more relevant, right? So these are more relevant modules, which compared to, let's say, early pregnancy might have a little less questions. But these are the modules that are to be covered. So what are the modules? First is clinical skills, teaching, appraisal, and assessment. This is something that is different in part two, which you will not be familiar with. And their way of teaching. So basically, it's a competency based teaching in the United Kingdom. And that is what they want us, as be someone who's trying to understand their teaching and their, rules and regulations. This is something that they would want us to know. There's clinical governance and research, ethics and legal issues. Their abortion laws are different. Consenting, the legal age for sex is different from other countries. So this is something that you'll have to learn. Core surgical skills, post-operative care, surgical procedures, antenatal care, maternal medicine, again, a very vast module, but a very beautiful module. Management of labor, management of delivery. Now, you have to remember that what we practice in real life could be much different than what is given in their guidelines, right? They have fetal blood sampling. They believe in continuous intrapartum monitoring. They have different forms of monitoring as well. So what we do, maybe what I practice today in my life is actually what different from what is given in the guideline. But the questions that we have to answer have to be answered strictly on the basis of the guideline and not what we practice in our clinical practice every day. I'm not saying that it is wrong. I'm not saying that what we do is wrong. Like it's not correct. Nothing is black and white. It's gray. But when we answer questions for the second part of your exam, you have to have everything in black and white because it is coming out of the guideline. Okay. Next comes management of labor, management of delivery, postpartum problems, gynecological problems like heavy menstrual bleeding, fibroids, menopause. They have beautiful, nice guidelines on this. Subfertility, we follow we have ESHO guidelines, and we have the nice guideline for subfertility as well. Sexual and reproductive health is where we use the BASH and the FSRH guidelines. Early pregnancy care, again, GTGs and nice guidelines. Gynecological oncology, mainly FIGO and BCGS, and urogynecology and pelvic floor problem is a subset of the gynecological problems. I will take questions in the end, Dr. Sangeeta, and minimal marks to pass are different every time. So there's no set mark that is needed to pass. The next, as I said, the key to understand are the resources that are available. And as I said, this is a repetitive slide, so I'm not going again over this. This is what we have. We know this is available on the internet, but utilizing it in a smart way is the key to pass this exam. Okay. So the clinical areas covered, as I said, are clinical skills, teaching, appraisal, ethics, core surgical skills, post-operative care, surgical procedures, ANC care, maternal medicine, labor, delivery, postpartum problems, gynecological problems, and subfertility, and specialized area like oncology, urogynecology, early pregnancy, and sexual and reproductive health. Now, what, as I said, is the most important thing is to manage this curriculum. And how do you manage this curriculum? By firstly breaking it down into smaller nuggets, focusing on the high yield guidelines. Revision is the key important. So revision and practice is something that goes hand in hand, because without practice, you cannot revise. Now, I'll give you an example. If you listen to the lecture, you go back, you solve the question. Let's say you solve the question on your own or in the Telegram discussion, and you actually go back and open your own notes and look at it. That is when the actual revision is happening. Not just blindly reading it again. That's not revision. Revision is when you think, oh my God, why did I go wrong? Let me look at my notes again. You open your book and you look at the notes or your printed material that you have, or you have written it on your iPad, whatever. It's your way of writing and dealing with it. But going back to your own resource, reading it again and actively retaining it in your conscience is what is revision. Again, as I said, group discussion is also important because something that you do not understand might be understood. Someone else might help you understand that. And obviously, we have guides and mentors to help you in the process of learning. The importance of mentorship is not only, so as I said, this is not something that is didactic. We don't believe in didactic learning. We want active and integral learning. There will be lectures, we will be teaching you in the lectures, but you studying yourself and having a self study component is very important, right? There are people who put, I've put this class, I've put this class, I've done this revision, but they still do not clear. Because what is the most important thing here is self study. And we, through our new program, want to motivate self study. Because anybody on this planet can give you lectures. You go on to YouTube, you will find lectures which are for free, right? But through our structured design, we want to motivate you all to actively learn. There is no point in just listening for a lecture for 4 hours and then absolutely forgetting it, or listening to a lecture, writing your notes. Yes, that is important. But what is more important is opening it, reading it yourself, solving the questions, and actively thinking about that what you have learned. Because in our busy schedule, that becomes a challenge. Because people who are going to give this exam, and not all of them are students. Some are postgraduates, some are recent, freshers who've just passed out, or some of them are senior consultants who have their full-fledged practice, and it becomes very difficult to listen to the lectures and then do this and then do that. No, self-study is the key, and we, through our program, want to motivate self-study along with incorporating the structured the lectures and the solving. Okay. Another important thing that we offer separately is the mock exams. Now, mock exams, you have to get used to the practice of solving. That happened with me. I felt that I could have done better was if I started solving earlier. I solved for the last 2 months of my preparation, and I felt that was my biggest mistake. I did clear in my first attempt, but I felt I could have scored much better if I would have solved earlier. So solving should happen from day one. Do not be scared of questions. What is the only thing that you can do is go wrong, right? So solving has to be from day one. It's okay if your answers are wrong, but you don't remember, it can be a miracle that in your exam, you can remember a question and say, oh, yes, I went wrong in this, but this is the right answer because I know I have gone back and I have read it. So mock exams will test your knowledge regularly, simulate real exam conditions because you have to acclimatize your body to give the exam condition, right? It's an online platform and question bank, so that is easy for you to access, and it will help you to progress the tracking of your progress and identify the weak subjects that you are in. So how do we utilize our resources? You will be getting a mini schedule on the premium WhatsApp group, which you have to follow by your self study. There will be daily practice of extended matching questions and single best answers on the Telegram group, and you will have a mentor who will be guiding you on those discussions daily. Now, how to utilize the resources with respect to the website? We have a website wherein we have given you all the lectures module wise. Okay. So, for example, infections and pregnancy, it's divided into parts because of it's some lectures are divided into parts, some are together depending on the size of the module, and we don't want to bombard you with too much of information. Now, how can you use these lectures? Okay, so first of all, these lectures are recorded because we are offering a hybrid program this time. They are recorded lectures, so you can listen to them at any point of time. You're sitting in your OPD, you're traveling, or you're at work, you're at home. You can listen to it at your own speed. You can listen to it at 1x, you can listen to it on 2x. Okay, so the your ability to listen and the ease of learning is in the environment that you're comfortable in is more with recorded lectures. After every after with the recorded lectures, you can understand what the guideline is. After the recorded lectures, what we also give you are the original module wise guidelines, that is the original GTGs. You don't even have to search the web. We have given it to you in the form of folders, in form of antenatal care. What are the guidelines that are necessary for antenatal care, for clinical governance, for core surgical skills, that will be given on the drive. After that, we have also given you summarized module wise lectures. Okay, so lecture guidelines. So these will be respect to what we have been teaching you in the lecture, and these are basically summaries for you to quickly go through. Now, some people might find it comfortable to read the guideline and make their notes out of it, or some would want to look at the guideline summary that we are offering. You all can read both. It is your choice. This is what we are giving you. It is, you have to find your comfort in and then progress accordingly. And in the end, we will also give you module wise practice questions on Telegram. Now, I'll just give you an example as to how we would want you to study, because this is what we feel is more, it's more, let's say it's more useful. What we felt was the whole concept of giving hybrid lectures was the number of people attending the live lectures is not a lot. The live lectures, the timing becomes difficult because this is something that is a global thing. If you're teaching in, let's say, Pakistan, or you're teaching in the United Arab Emirates, and someone is attending in Africa, or someone is attending in the Europe, timings are completely different. So that is one thing that we wanted to overcome. And second is the ease of environment in which you're studying. Recorded lectures you can listen to anytime. Okay. So let's talk first about how to read the Green Top guideline. So the Green Top guideline, what we would suggest is that you first start reading the original guideline in the drive that we have given. Now, before when you start reading, first of all, you're going to be lost. Okay. And we are here to make sure that you don't get lost. Okay. So in the guideline, what do we have? We have, if you open a guideline, you will have an executive summary, right? Which will hardly be 2-3 pages. So that is basically just the gist of whatever is the most important things in the guideline that you have to take. Okay. And then when you read further, then they have given you a lot of, then they give you text, they give you meta-analysis, they give you numbers in the guideline, which are not important to us. The numbers which are important will be in the executive summary. So the first thing that you have to do is read the executive summary. Then second time, read the guideline again and take out your own notes. We are giving you notes, okay? We are giving you printed material, not printed material. We are giving you summarized material in the form of guideline summaries online, and even talk summaries. But having your own material, be it in the form of screenshots, in the form of printed material, or your own handwriting, that is totally your call. And the third reading is guideline reading it again, but obviously it will be faster and in a speedy way because you are already acclimatized to that guideline. You will struggle a couple of weeks, maybe a week or two, you will struggle. You will not understand. You will feel, oh my God, I'm taking 1 hour just to read the executive summary. But this is something that will gradually happen. You will pick up the pace. And once you understand how to read a guideline, you'll be able to revise it in less than 15 minutes. Okay. And revision. Then what you have to do is first reading happens, second reading, third reading. All of this you can take one day because we are giving you a mini schedule, right? We're giving you one day to do all of this. Visit the Med Institute website, go through the guidelines, and you can also listen to the recorded lecture. Or you can also listen to the recorded lecture and then go back and read the guideline. That is completely your call. Some people would feel like, no, I don't want to listen to the lecture. This is not complete. Okay. No, I don't. I want to read what is actually being taught. Then you can go to the guideline and go to the lecture. Otherwise, you can go to the lecture first, understand what is the gist of the guideline, and go to 1, 2, 3, 4 steps. Okay, this is how you read the GTG. Then the talk is again read in the similar way. You have the original talk, you go read make your own short notes, go through the talk again, and then 2, 3 minutes the summary. Or you can, instead of going through the summary, you can even look at your own notes. Now, what is important in talk is to understand that the recent ones need to be covered, like 2023, 2024, 2022, and the ones which are being discussed in the lectures. The ones included in the lectures are the important ones. Now, for example, our first 3 modules that we are giving are the infection in pregnancy, early pregnancy care, and surgery and postpartum care. Now, infections in pregnancy, you can see that we have given you a small, a mini schedule. There is first on 24th of January, you're reading chickenpox in pregnancy. On the same day, you're reading tuberculosis in pregnancy, which is a talk. You will have to go in the same way that this is something that we are offering, but you can come up with your own plan as you go along, right? What is more important is that you understand what is given and you are able to solve questions. So this is, for example, for infection in pregnancy. You have chickenpox, you have early onset GBS, malaria, the HIV guidelines, Zika virus, coronavirus, and also there's a self-study day. So what is the whole concept of self-study day is that if you're lacking here, obviously we're not gonna be free all days, right? You might have an extra surgery, you might have an emergency duty. So this is the day where you can cover up. And I think what is the most important is, you know, uh, turning up each day and reading something. When I was preparing for my exam, I used to always have my iPad in my hand because I was either solving or I was either listening to a lecture, or I was either making my own notes. I had made my own notes on my iPad and I had revised it. Okay. And the only point that I said was my solving came in a little late, but I don't want any of you all to repeat the mistake that I did. Solving is something that has to happen. uh Guided lecture, so the whole concept that we're giving to you is we're giving you resources at your at your discretion. You can use it however you want. You can listen to the recorded lectures, and after 3 modules you will have a live session with me where I will be introducing you the further modules and also taking your doubt solving. Any problem in any of the new in any of the modules that you've had, any and we would also recommend that you, like, let's say if I have a live session tomorrow, that at least 2 days before you would tell me what you want to be included, because there will be a few points that I would talk about, right? Like a couple of doubt solving and some difficult questions that you want. Or let's say you have a GTG that is, now you're not understanding through the live lecture, through the recorded lecture, then that is something that we will cover. Okay. At the same time, we will also have some free sessions and some live sessions throughout your course. But what is more important is that by giving you a hybrid approach to this learning, we are giving you the power of resources in your own hand and also motivating you to study every day, because that is what is important to pass this exam. So basically, you have to be motivated and stay focused. You have to visualize the success, and you have to know that you will pass part two, and you have to know why you want to pass part two. Some want to go to the UK, some want it as a accolade on your name, but it is something that we all want, and that is why we are here today. Celebrate small wins each day. The whole concept of actually getting up, opening your resource and reading it and being able to solve questions is itself commendable, because doing it every day is what is the most difficult part. Consistency is what is the most difficult part in any preparation. Okay. Stay connected with your mentors and your peers through the WhatsApp and Telegram groups. You have to understand that you are not alone. This is manageable. Dedication and consistency is of the utmost importance. You have to believe in yourself. You are going to clear part one, and you will be able to clear part two as well, because self-confidence is crucial. Focus on progress and not perfection, that you have to be consistent with your efforts. Now, I believe in this mantra that you have to read, relook, and revise, right? So, read is when you first read any particular guideline. You relook is when you read again, right? There is a major difference between relook and revise. If you think just going back and looking at it is revision, it is not. Revision is when you solve, you go wrong or you go correct, and you go back and you revise from your notes or from the resources that you have. That is revision. So it is read, relook, and revise. Okay, this should be your mantra to clear this exam. Also, along with our resources, there are books that you can use. These are, Jinesh Gupta, Get Through MRCOG. All of these are available to you, and we will make it available to you through our Telegram as well as the website, so that you all can solve these as well, apart from the questions that we are obviously going to give you. And to enroll, you can contact us on the number or get in touch with Dr. Sadia or Dr. Minhal, and we will be with you throughout your, throughout your guidance. Throughout your journey of part two. Another question that I think you all will have is that should I give it now or should I give it like in July? That is again, this is a very personal question. It depends on what stage of life you are in. What is your ultimate goal? Do you have a timeline? I gave my so I was on I, honestly I prepared for 3 to 4 months and I gave the exam. I feel I was lucky that I could pass, but I think luck is not something that you have to bank on. I still feel I could have done much better if I would have solved before. I would have prepared in a little better way. So this is something that through my experience and through our other fellow senior mentors' experiences, we are giving you a curated program. Your suggestions are welcome. Any, suggestions or changes that you would want, or any whatever you feel like is okay, this could be different, or this is what I want. Could you help us with this? We are here to help you out. And if you have further any more questions, please let me know. I'm opening the chat. You can put it up in the chat box, and I will answer them. There are already a couple of questions that I'll take. So Dr. Sangeeta is asking minimum marks to pass. As I said, every year it's different. Sometimes it's 65, sometimes it's 67, sometimes it's lesser, 62, 63. Depends on the exam. Should we have printed material? What about website keys? So printed material is something that again, Dr. Momna, depends on how you want to study. For someone like me, I prefer studying on in a soft copy on my iPad or my phone, so I don't have printed material. But someone who wants, it depends on how you've been studying. If you've been classically reading printed material, you can print it out yourself or write down in notebooks. It's completely your choice. Summaries are updated. Yes, they're updated till 2024. Any new updates, maybe a couple of guidelines also will be updated. So new lectures will be posted for the guidelines. Do we need to pass part one to? Yes, doctor, you have to pass part one to appear in part two. Any more questions, guys? If you have any questions regarding how, yes, the website keys are updated. We keep on reviewing the website. So what happens is that many of the books might have keys which are older because the guidelines could be older and they keep on upgrading, right? So that could be a problem. So that is why we keep on updating the keys on our website. If you all have any question, any doubts regarding what we are offering or the hybrid program that we're offering. So yes, Dr. Zeenath, that is what I said. 5 months is enough time to prepare if you are dedicated. If you can give that much time every day to study and to revise and to solve questions, you can start reading. Please can send. We have so how much time per day is again your call, doctor. Depends on how much you're studying. So literally, when I was preparing, I knew I did not have enough time. So, Dr. Hira, so I knew that I had to utilize whatever time I had to, to read. So even if I was sitting in the labor room monitoring patients, I would have a book in my hand, right? So that is how you have to think. It has to be constant if you know you want to give this exam. It is an expensive exam. It takes a toll mentally also. So it is something that you would want to give your best in the first go. Yes. So again, that is something that you would, it is you have to judge if you can give time. I did not have the additional responsibilities. So I could give that much time I did not have a household to take care of. So I could give those exams without additional responsibilities, but you have to take this call. We can guide you as to help you take the decision, but it is your decision. But I would, if you feel you have to, like this is your timeline, you want to do it, then you will find time even in your busy schedule. When are we starting the sessions for part two? Will topics from part one also be asked in part two? So, Dr. Vignesh, so the topics from part one that are asked in part two are mainly statistics and research, and not much otherwise is asked. Is mainly focused on the guidelines and the sessions. I think I'll just ask the team to help you out with when we will be starting the session. Any more questions? So, I don't want you all to get scared, okay? Because I know the number of modules that I've shown you on the slides. It feels scary, okay? I remember when I began my preparation, I was lost. I was lost for at least a month. I did not know what to read. I still remember, I still have a notebook wherein I had written a TOG notes, and I did not even read it again when I was preparing, actually preparing. So we are lost. And that is why we are here to guide you so that you do not waste your crucial time. Okay. Dr. Lavanya, benefit of clearing MRCOG, like some people want to work in the UK, some people want to go to Australia, some want to work in the UAE. All of this helps in, working there, as well as it helps in your resume, even if you're working in your own country. Dr. Vignesh, it does, because you have to clear your MRCOG to get a job in the UK. And I think in the UAE, you don't have to give their exam if you've cleared MRCOG. But I am not sure yet. I'm not sure about the UAE. Pattern of recall, Dr. Nazia. Not much of a recall. It is more of understand. Some SBAs might be recall. EMQ recall is again a very difficult thing that it is impossible to remember a EMQ, right? So EMQ mainly you have to understand the concept and the guideline, which can be a recall. Like they are asking commonly from the VTE guideline, or they're commonly asking you from the nausea vomiting guideline, but not, no, it is not as heavily based on recalls as part one. I am not aware of that. Dr. Zeenat, Dr. Minhal, and Dr. Sadia will be helpful for this. All new questions. So, Dr. Nazia, not all new questions, because it's, there will be something that will be picked up from the past. But as I said, it is not, don't rely on recalls for this. You have to rely on your understanding of the subject more for this exam. You cannot pass it only on recalls. You could pass part one on recalls, but not this exam. No. Dr. Caroline, how much does the course cost? Please get in touch with Dr. Minhal or Dr. Sadia, and they will help you out with it. Can you explain a bit about EMQs? Hmm. Okay, so I have not included an EMQ example in this, but let's say, so you need to know one of the guidelines for me to able to understand. Let's say you have a patient who is, uh, so there's a guideline on recently upgraded guideline on chickenpox, and a patient presents to you with, let's say they'll give you a scenario. You have a 28-year-old woman who is a in a first pregnancy, who's a school teacher, and she comes in contact with a child in her class who has had chicken pox, and she comes to you and says that I'm not immune. You do her IgGs, and she is not immune. So what would you do next? So according to the guideline, she is eligible for post-exposure prophylaxis, and you will be, so that is given, cyclovir is given within 4 to 10 days. So the options in your EMQ, so this is your STEM, right? And your options would be do nothing, test IgG, then give a cyclovir, give immunoglobulin, or give just prophylactic treatment, or not prophylactic, just symptomatic treatment, give emollient, okay, give her vaccination. So these will be the options in your, there will be multiple options, like 5 7 8 options, and you have to choose the correct one. Now you know that she's fitting into the post exposure prophylaxis because you have read the guideline, and the guideline says that you have to do this when this scenario happens. So then you'll be able to choose the right option. I'm not without understanding, maybe if you read a cup one or two guidelines, you'll be able to understand how the EMQs are given. Any more questions, guys? I hope you all had a good time with us during our part one preparation. And I know you all will have a good time with us for your part two preparation as well. You have to basically understand that the, the part two curriculum, the preparation, the resources is basically, it's an ocean. Okay, it's an ocean of knowledge. But what is important is you have to have a guiding boat in it. You have to sit in that boat and just keep on picking up what is important and then reach a destination, which is to clear the part two exam. Okay. So I hope we could answer your questions. For any doubts, you can please get in contact with the backend team with Dr. Minhal and Dr. Sadia. They'll help you out with it. Regarding the course schedules, what is free, what is the cost, please talk to them. They'll help you out. And I hope I could, make you understand what the part two exam is. It is not difficult. It is challenging, yes, but it is not scary. So please, I want all of y'all to have a positive attitude towards it. And positive attitude is one of the first steps for conquering this exam. Okay. So I hope to see all of y'all in the preparation, and I will be there with y'all throughout. And otherwise, we all can take a break, enjoy your time. Once you be for the results, also we'll be in touch with you. And hope to see you all soon. Take care, guys. Oh, yes, Dr. Leila, we will ask the backend team to help you out with that. Okay, bye-bye. Nice talking to all of you. Thank you, Dr. Stephanie. Uh, Take care and happy studying, guys. Bye-bye.